MTV brings it into focus with a new weekly series, True Life.
So, guys.
Good morning. All right, good morning, class. We're going to do our roll call, and then we have some lecture quizzes. All right. Go ahead and open up your laptops. Go ahead and get your quizzes on. I'm going to give you 10 minutes, and then we have to move on to our first lecture of the day.
Yeah, I'm about to pick him up, and we're probably gonna go to the park. All right, I'll call you. Hi, hey. James. How was your day?
It was good.
It was good. How was school's good?
Yeah, school's good.
Okay, we're gonna go to the park today.
Okay.
Is that?
Oh, Mom. Hey.
Hi.
You're James' mother, right?
Yes. Hi, Miss Mitchell.
Yes. Hi. I need to talk to you really quickly about James in class. Okay. You want to do this with James here?
Oh, you could go to the car. I'm gonna talk to your teacher. I'll see you. Okay.
All right. Yes. So I've been noticing that he's been having like grunting, extra sounds in class.
Oh.
It's kind of becoming more distracting. I don't know if you want to take him somewhere, get it checked out.
Okay.
I know you said he had ADHD, but this seems a little bit more.
Oh, really?
Yeah.
Okay. And it's distracting the class?
Yeah.
Okay.
Yeah.
Maybe I'll take him to the doctor.
Okay.
Okay, but thank you for letting me know.
No problem.
All right.
Yes. You have a good day.
You too. Thanks.
Bye, James. What?
Oh, buzzer beater. Oh.
Hey, son. So, how you feeling?
I'm feeling good.
You're good?
Yeah, I'm okay.
Okay. Do you feel like anything's off at school?
Yeah. I mean, I've kind of noticed that, like, a lot.
Yeah, like that. That seems new.
I'm starting to have like these like random outbursts in class, and I've noticed that like more of my classmates are like staring and looking at me, and like I just can't control it. Like I have like an urge to blurt something out, or like
Is that what you need to? Oh,
yeah, like I don't know how to control it.
Do you feel like you're distracting like your class, or?
I think so.
Yeah.
More and more people are starting to look at me.
Yeah, Miss Mitchell said something, so I don't know, maybe it is a big deal.
Yeah, I don't know, maybe we should go to the doctor. I don't know.
Yes, we've been keeping up with your meds,
Yeah.
Maybe we should go and see what's going on.
Yeah. Yeah.
There's something wrong with my son. I just really hope they can figure it out. All right, son, when the PA comes in, just make sure you explain everything to them. This isn't the time to like hide anything. You have nothing to be ashamed of.
Okay.
We just need to see if the meds are still doing what they need to do.
Okay, I will.
Chief complaint: I have random movements and outbursts I can't control. HPI: 16-year-old male with past medical history of ADHD presents to the primary care practice office with his mother with chief concern that have been occurring since he was the age of 6, but have been progressively getting worse in the past 6 months. Patient described these movements as sudden, rapid, recurrent, and non-rhythmic, eye blinking, face grimacing, head jerking, and vocalizations, such as throat clearing, whistling, and grunting, following an urge. Stress typically makes the symptoms worse, but nothing makes the symptoms better. Symptoms occur anytime during the day, including at night. Patients state these episodes are affecting his daily living by not wanting to go to school because he is embarrassed by his outbursts. Patient denies any sick contact, recent travel, fever, fatigue, weakness, malaise, insomnia, change in mood, attention span, memory, confusion, changes with level of consciousness, headache and dizziness, fainting, blackouts, paralysis and numbness, tingling throughout the entire body, and tremors.
Okay, James, we're going to assess your overall health and well-being. We're going to be looking for involuntary movements. We're going to look at your speech, at your motor function, and just kind of your overall affect and how we're working together. Yeah, I do notice the tics that I'm seeing.
Yeah.
Okay, Shakira, so what do you think some of the differential diagnoses are?
So for the head, I was thinking maybe a traumatic brain injury because of the irritability that he's having with the twitching.
Okay, but his mom did say he doesn't play any contact sports and there's been no recent head trauma, so I think we can rule that one out.
Okay, what about the eye? Maybe the nystagmus because of the twitching, the repetitive eye blinking that the patient has been having with the neck movement?
Yeah, but when I did the extraocular movements, you didn't have any nystagmus, so I think we can rule that out as well.
All right. Did you check the throat? Did he have a recent strep infection?
There was nothing that I saw, no exudates, no void patches in his throat was normal.
Okay. And then what about his muscle spasms because he's having the uncontrollable muscle movements?
There was no pain with the movement and there was no muscle cramp, so I think we can rule that out as well.
Okay. And does he happen to have a history in regards to psych for OCD?
No, he has a history of ADHD, but not OCD. There's no recurring or intrusive thoughts.
And for neuro, I was thinking possibly dystonia because of the involuntary muscle movements, the facial grimacing.
Mm-hmm.
What do you think about that one?
I don't really think he has dystonia because he doesn't have the twisting movements of the head. It's more just a jerk reaction.
Mm-hmm.
And he doesn't have a history of seizures or torticollis.
And you did say that he has ADHD,
mm-hmm.
and that was diagnosed at what age again?
I think at age 12.
Okay, so I'm thinking because of the ADHD and possibly I'm thinking Tourette's as well.
That's a really good idea. I know there's many kids who get misdiagnosed with ADHD that have Tourette syndrome.
Right, because you did say that he had the excessive blinking, the throat clearing, the whistling. I did notice when I was in the room, and the continuous head jerking.
Right.
Okay. I was also thinking some other things, but we'll need lab testings for that. So I'm not necessarily going to go with the other options that I was thinking.
Okay.
Kind of in the midst of thinking of Tourette's.
Okay. Do you want to talk about the diagnostic criteria for Tourette syndrome?
Yes, let's do that.
So you need at least multiple motor, so 1 or more vocal tics for greater than a year. And it seems like our patient has been having that because we witnessed that in the room. Onset has to be prior to age 18. Check, he's 16. And it's not explained by other medical conditions or substance use. So I think it's kind of pointing us to the right diagnosis.
Hi, James. So we believe that you have been misdiagnosed with ADHD for Tourette syndrome. Mom, there is a possibility that the symptoms may resolve by the age of 18, but that's only a 50% chance.
Okay.
Some of the educational pieces to this is that we can write him a doctor's note for him to be in an IEP course, just so that he's more comfortable in his learning environments. And also, we will also recommend that you put him in a support group, just so that he knows that this is normal, it happens, and that there are other people who have been diagnosed with Tourette's. But like I said, with the possibility of treatments, things can help resolve the symptoms.
So some of those plans, like Shakira was just saying, are like the comprehensive behavioral intervention. So it's basically you go participate in activities that require concentration. We're going to make sure you exercise regularly, eat healthy. And like Shakira mentioned, the counseling and therapy, we can like reference you to a family counselor and also like an individual counselor. In terms of like medication wise, we're going to start taking you off of the amphetamine, but we're going to do it in a very careful way to make sure there's no like adverse reactions to that.
Okay.
And then we're going to start you on clonidine. Have you ever had that before?
No. I don't think so.
No.
Okay. So we're going to start you at the lowest dose, which is 0.05 milligrams. You're going to take it 1 time a day at bedtime, and then we're going to see you in a week. So we're going to schedule an appointment. You guys are going to come back in a week. We're going to discuss, make sure the treatment options are working, and to check in with you guys.
Okay.
Okay.
Do you have any questions for us?
No. Well, we're going to see the therapist?
Yep.
Okay.
Yeah. We're writing that up right now for you guys.
Okay.
All right. Thank you.
You're welcome.
All right, I'm Miss Black. I'm your family counselor. How are you all doing today?
I'm good.
It's been a long day.
Yes, I know, I heard. So I just want you to know that there are social support options for Tourette's, you know, to be able to cope, and that your access to healthcare, you know, the financial barriers, insurance coverage, all of that can kind of impact as well. So if you need any help, I'm here with that. There are IEP plans that you can be a part of at school, as well as some workshops for parents as well, because I know this must be very hard on you. And then for stigma, we do have, or we do recommend that you raise awareness as well, you know, and this is why we're doing this documentary I heard today, is to just raise awareness about that, but that will also help with some of the stigma, okay? Do you have any questions?
No. Do we see you weekly as well?
Yes.
Okay.
I'm here whenever you need me, okay? As often as you need.
Thank you.
No problem.
To ensure that James does not feel discriminated with his newly found diagnosis of Tourette syndrome, there's an act called the American Disability Act of 1990. This law was signed by George H.W. Bush on July 26, 1990, and it was put into effect to allow individuals with disabilities from discrimination in the workplace, in education, as well as in transportation. This also includes individuals who suffer with Tourette syndrome, as James does, and this would allow for accommodation in school to ensure that he gets the proper support services to accompany his learning.